Good morning. I've been talking a lot this season about healthcare in America, and there's a good reason for that. Many of you have seen my shows where I said my little cousin was recently diagnosed with stage 3 metastatic breast cancer. My cousin, Nicole Lynn, and her husband thought they were doing everything right. They had health insurance. They've been paying for decades. All of their adult lives, they've been paying for health insurance. They never asked the government to provide them with anything. And now, when they really need it, they're realizing that all the Obamacare, all the stuff that they promised us, well, that really doesn't apply to people like them. Doesn't apply to people like me and my husband either. Doesn't apply to a lot of people in America. And that is because as much as Obama tried to bring our country into what almost every other country in the world has, national health care provided to you as a citizen of this country based on your birth in this country, just like Social Security. The day you're born, you get a card. It's your national health care card. It means you go to the doctor, you don't pay. You get a prescription, you don't pay. You go to the dentist, you don't pay. And most other countries have this. Cuba has it, for God's sake. Jamaica has it. Canada, England, all of Europe has this. National health care. But in our country, for some reason, in America, we have been so terrified of national health care. Now, there's good reasons why we should be terrified. First of all, it's interesting to me that most people, when I talk national health care to them, they say, oh my God, we can't trust the American government to take care of our health care. Isn't it weird that like 140 million mothers trust the American government to take care of their children on welfare and food stamps and Medicaid? And they're doing just fine. I've told you the story of my neighbor. Never had a full-time job. Never paid into any insurance. Never had health insurance. She got stage 4 non-Hodgkin's lymphoma, and she's still alive 15 years later because all her care was paid for by the United States government, our tax dollars. Thank you very much. I hope she sends thank you notes to all of you. She's healthy. She beat it. She beat stage 4 cancer. She got all her chemo. She lost her hair. She got her wigs. Everything. No cost to her. Because she didn't have a job. The government took care of her. So we trust the government to do some things. We trust the government to provide food for our children. Health care for children, because God forbid we have children and we have to pay for health care for our children, right? But we don't trust our government. This is what people tell me with national health care. This is what the show's about. Why no national health care for Americans? You say, we can't trust the government. No, you know who you can't trust? You can't trust health insurance companies. They don't want national health care in America because they're going to lose their jobs. You can't trust hospitals and medical providers because their salary is going to be cut in half. I'm going to explain all this to you as the show goes on. Because I know people. I actually talk to people who live in the countries that have national health care. And all the nightmare scenarios our country, our Americans are being told and believe, and they parrot back to me, that's not true. Nobody's dying over in England waiting for heart surgery. No one's dying in Canada waiting for a heart transplant. I'll tell you what they're not doing in England and in France and in Germany and in Cuba and in Canada. They're not claiming bankruptcy because of medical bills, because they get sick, because they need surgery, emergency surgery. They're not losing their homes. They're not losing their savings or their retirement. Only in America does that shit happen. Pharmaceutical companies, they don't want national health care in this country because they're not going to be able to charge $4,500 for one dose of Neulasta for cancer patients. Not going to be able to get away with that anymore. And Obama did try. He tried. The problem with Obama is he went just far enough that people like myself, my husband, and my little cousin and her husband, and other people like us ended up getting screwed. And some people did benefit. But who actually ended up benefiting was the health insurance companies and the pharmaceutical companies, because what happened after Obamacare was when the insurance companies found out they were going to have to insure people with pre-existing conditions, people who were sick and had never paid for insurance before, well, they lost their minds. And I kind of get that. Because, see, my husband and I and my cousin and her husband, we always had health insurance because it was important. We didn't use it, but we had it for that, just in case shit happens, right? But too many people in our country said, well, we can't afford just in case shit happens because we have to go to Disney World and we have vacations to take and we have $250,000 houses to pay for. We don't worry about insurance. We're young. We're healthy. Who gives a fuck? Nothing's going to happen to us. So they didn't pay. And then, lo and behold, surprise, surprise, they got sick. And then they couldn't get health insurance. Then they became all of our problem. And Obama said, okay, I'm going to force the health insurance companies to take people they won't take. They don't want. Remember those questionnaires you had to fill out before Obamacare? Have you ever in your whole life had a sinus infection? And if you say yes to any of those questions, well, I had a sinus infection like 10 years ago. Oh, we're going to put some kind of rider on your policy. We won't pay for any more sinus infections. Obama said, no, insurance can't do that. And that's true. They shouldn't be able to do that. The problem is, now that the health insurance companies had to pay for all these really, really sick people, and the sick people hadn't paid in long enough to accumulate enough money to pay their bills, well, those bills got put on to all us healthy people. Us healthy people, yes, yes, yes. And because you can never deny health care to a child, anybody with kids, they got a free ride, like they always do. So what happened to people like my cousin and her husband and me and my husband and millions of other Americans is the health insurance companies said, well, fuck you, President Obama. Guess what? Yeah, we'll take the sick people, but the healthy people like Jason and Paula and Nicole and Rob, we're just going to start bumping up their premiums. They're going to pay more. So other people that you say don't have to. People who never paid in will be covered by the extra we're going to charge the people who have always paid in. So what happened to me and my husband is we saw our premiums triple and double. And then the pharmaceutical companies said, well, fuck Obama. We're going to just raise the cost of our drugs. And they did. They raised them a lot. I recently found out that diabetes, you need insulin, right? The person who invented insulin is a Canadian. He was a Canadian. He sold the patent for insulin for $1. $1. Because he knew that with 1 in 3 people being diagnosed with diabetes, he saw that this was going to be an epidemic at some point. And so he said, I don't want to be a millionaire. I don't want to be a billionaire. I don't want to be a 100,000-aire. Here's the patent. He sold it to pharmaceutical companies. And you know what the pharmaceutical companies have done since 2003? In 2003, insulin was $45. Now it's $400. Diabetics are not taking their insulin, they're sharing their insulin, or they're heading up down to Mexico where it's half the price, or 40 bucks, 20 bucks, or they're going to Canada to buy insulin. The pharmaceutical companies refuse to lower their prices. All they care about is getting rich, when what they should be caring about is that their drugs are supposed to save people's lives. And anybody who works in an industry where your product or your service saves lives, I'm sorry, it shouldn't be about the money. I don't care if a doctor goes to school for 100 years and pays $1 million to get a doctor degree, an MD. You don't get rich. And America, by the way, is the only country where doctors and surgeons and medical administrators, hospital administrators, are millionaires. Hospital administrators make millions of dollars off of your sickness, off of your illness, and they're not doctors. They've never treated you. They didn't save your life. They just run the hospital, where the surgeons charge $500,000 for 3 hours of their time in a surgery, $26,000 to put a port in so you can receive your chemo. This is anesthesiologists. Oh my God. Get an anesthesiologist bill sometime. Sometimes the anesthesiologist charges more than the surgeon. See, in Europe, where they have national health care, and in Canada, doctors are salaried. And their salary is very low compared to American doctors. Surgeons in Europe do not make $600,000, $1 million a year performing surgeries. They live very well. They still live better than 90% of the population, as they should. They're very smart, and they do good work. But they don't live the way American doctors and surgeons live. And they don't have this attitude that it's all about the money. You walk into a doctor's office and you don't have insurance, and you say, I'm going to self-pay, they make you pay before you walk into the doctor's office, in case you try to sneak out without paying. It's all about the money. And it's outrageous what they charge. $250 for 15 minutes of a doctor's time? Are you kidding me right now? And that was the last time I went to the OBGYN, which was 4 years ago. Now I had insurance, and insurance has to pay for pap smears with OBGYNs. But boy, they try not to, those insurance companies. They're sneaky little mothers. When I was at my pap smear, the OBGYN noticed I had a yeast infection. So he did a swab to confirm it was a yeast infection. I get a bill in the mail for $250 freaking dollars for the whole exam. I called. I said, you know what? Sorry. This was my annual exam. Covered under Affordable Care Act. Obama said so. The guy I voted for twice, he promised I could have a pap smear. No cost to me, no deductible. Oh, sorry. Because he found something like a yeast infection, which again, he gave me a pill and gone in a day. They tried to charge me for the entire freaking exam. And I said, no, I'm not paying you a dime. That's why I went to the gynecologist, to see if there was anything wrong. I didn't know I had a yeast infection. Didn't have any symptoms. But that's why you go for physicals. My husband went for an annual physical. They discovered his A1C. He's diabetic. All of a sudden, they charge him for the entire visit. And that doctor fought back. And the insurance company ended up saying, nope, sorry. Sorry, Mr. Luciano. You went in for your annual exam and you got screwed because Obama said it should have been free. The Affordable Care Act said that exam should not have been $300 and some dollars. But the doctor coded it as an ill visit. Gotta pay. You had to pay the $300. Outrageous. True national health care means that everyone is treated equally from the day you're born. It also means that only citizens, meaning you are born in America. And I don't mean that you come over from Mexico and drop a baby and that baby gets national health care. Because I can't go over to England and drop a baby and then England says, national health care applies to you now. Your kid's a British citizen. Doesn't work that way. But every American citizen, when they're born, during real national health care, if we had it, would be given a national health care card. Now, yes, there might be issues. Just like people on Medicaid, people on welfare have issues. There are some things that they might have to wait a little longer for or whatever. If you are one of those fortunate people in our country who can afford to buy private health insurance, that too is available. You can go out and buy another policy. And if you want that, and then you combine that with your national health care, you can do that. Just like people on Medicare, our elderly citizens. Guys, they can't rely on Medicare. They have to have supplemental insurance. You can do that with national health care. You don't just have to rely on the government. And as far as the wait times go, well, I know so many people in America that I've spoken to who need to see a specialist right now, and they're on a wait list. And we don't have national health care. They have their regular health insurance. They're not on Medicaid or Medicare, and they have to wait 3 months to get an appointment. If I want to schedule a pap smear right now, I can't have a pap smear like tomorrow or next week. I've got to wait. I've got to schedule it like 3 months from now. So if I want my pap smear, my annual ladies exam in September, I have to schedule it in June. Or else I'm not going to get it in September. Now, to be honest, I am picky with my times. I want first appointment of the day. However, it still doesn't matter. Because I have called and said, when's your first appointment? And then 3 months from now. So if you think that the people in England are dying while waiting for surgery, they're not. I talked to a woman in England when I first got on Facebook, and she is still alive to this day, and she told me that she was diagnosed with stage 4 cervical cancer. And she was so thankful because she survived it, and she was never sent one bill. No bill. She had surgery, she had chemotherapy, not one bill. She just didn't have to worry about, am I going to lose my house? All she had to do was worry about getting well. Kind of like the St. Jude slogan, all a parent should have to worry about is their child living. Well, that's all anybody who's diagnosed with a life-threatening illness should have to worry about, is living. Not, oh my God, if I survive this cancer or I survive this illness, am I going to have a house? Am I going to have my retirement? Or am I going to have to liquidate everything I own to live? Everything I've worked for the past 30 years. Am I going to have to lose that in order to live? No one should have to deal with that situation. Not little children, not parents of little children, and not adults who all their lives have gone to a job every day and have done everything they were told they should do. Paid into the health insurance companies, paid their premiums, been responsible. No one should be faced with that horrible decision. Do I fight this disease or do I just die because I don't want to leave my spouse or my children with absolutely nothing at the end of this? I don't want to start over at age 52 or 53 or 56 or 60. I do have a solution, by the way. I usually don't have solutions, which is why I tell you I've never run for office. But I think there is one way, and it's really not that hard. I would like to know why here in Pennsylvania, a mammogram costs X amount of dollars. In New York, it costs more. In Missouri or South Carolina, it costs less. Same thing for prescription medications. Pharmacies. At one pharmacy, a drug can be $400. At another one, it's $24. How about we say, let's do some regulation? I'm not usually a fan of regulation. I don't like people telling me I can't buy the cigarettes I smoke because children have been buying them illegally. I usually don't like government regulation, but we need to regulate. We need to regulate healthcare premiums. We need to cap them for individuals and for couples, especially. That the insurance company cannot charge more than a certain amount, a fair amount. Not this ridiculous $1,500 a month with a $7,500 deductible for two healthy 50-year-old people like me and my husband. That's ridiculous. Self-employed people. You cannot overcharge self-employed people, health insurance companies, any longer. Just because they're not part of a group. Can't do that. And let's regulate the pharmaceutical companies. If a prescription for a drug is $25 at the Walmart, then it should be $25 at the CVS, at the Walgreens, at every pharmacy, in every city, in every town, in every state in the United States of America. People in California shouldn't pay more because they make more money. Your health expenses should not be determined by your annual income. It shouldn't matter if you make $10,000 a year or $300 million a year. You should pay the same for a dose of Neulasta as anybody else all over the country. You should pay the same for insulin all over the country, whether you make $10,000 a year or $3 million a year. A gallbladder surgery, a heart surgery, cancer treatments, all regulated. You can't charge someone in New York $15,000 for chemo and charge someone in Florida $5,000 for the same exact chemo. Regulate the prices. These people are getting rich off of our misery. We don't want to take their drugs. We don't ask to take their drugs. It's not like, ooh, I just really want to go on chemo tomorrow. I hope I can afford it. Oh, that's just my dream, my Christmas wish. Nobody wants your poison. But when we need it to survive, to watch our children grow into adults, to watch our grandchildren be born, we have to have your poisons, your drugs. And we shouldn't die because we can't afford to pay for them. True national health care makes everybody equal. The millionaire and the unemployed person who never plans on getting a job but wants to have 6 kids. They're equal in national health care as long as they were born in this country. That's what national health care is, folks. And since for some bizarre reason, we all think it's absolutely fine to have socialism when it comes to taking my money and giving it to people who don't work and keep having babies they can't afford, and giving my money to them, I don't see why we can't trust the government to take care of my health care, your health care, or at least let them try. Let's see what happens. If we really had the national health care that my friends in England and Canada and the people I met in Jamaica have, the people who can't believe what we are charged for an operation in this country, for pharmaceutical drugs. They can't believe it when we tell them. It's outrageous to them. I'm talking Jamaica here. I mean, in Jamaica, people make like $5,000 a year, but they don't pay for drugs. They don't pay for medicine. They don't pay for surgery. They don't pay if they break their arm. They can't believe what we're charged. They are so blessed. They feel so happy to live in Jamaica. They'd rather live there and make $5,000 a year than live here and make $60,000 a year and pay it all to insurance and farm drugs. They always say, well, we'd love to live in America and make some money, but we certainly can't afford to get sick in America. That's the problem. We are the richest country in the world, or so we claim, and yet we are the only country where we can't afford to get sick. Let's talk about it. Political Paula is out. I love you, Nicole.